welcome to my YouTube channel. And today the topic we are going to discuss is pulmonary arterial hypertension. So first of all, we'll go into the pathophysiology of pulmonary arterial hypertension. There are actually three reasons that cause the pulmonary hypertension. The first of all, that is the endothelial pathway. The second is the nitric oxide pathway, and the third one is the prostacyclin pathway. So how they do the pulmonary hypertension, we'll go deep into the pathophysiology first. So what is actually endothelium? Actually, endothelium is actually a chemical released from the endothelium in the form of proendothelium, that is released as endothelin 1 and attached to the endothelin receptor. These endothelin receptors are actually the smooth muscles that are present in the pulmonary arterial vasculature, and that endothelium, when attached to the endothelin receptor, causes the proliferation of the smooth muscle. And when these smooth muscles proliferate, they actually cause the constriction of the pulmonary vasculature and ultimately leading to the vasoconstriction. So one of that is causing the pulmonary hypertension. So at the same time, we also discuss how we can prevent through this pathway the developing of the pulmonary hypertension. So for this we use the endothelin receptor antagonist. These act there, so that actually cause the prevention of the pulmonary hypertension. The second pathway is the nitric oxide pathway, that causes the formation of the nitric oxide. So what happens here? How nitric oxide is formed? First of all, in the endothelium there is conversion of the L-arginine to L-citrulline. So that causes the formation of the nitric oxide. That nitric oxide causes the formation of cyclic GMP, that ultimately leads to the vasodilation. So as you can see that this causing the vasodilation and decreased proliferation, so one can think how it can cause the pulmonary arterial hypertension. It can cause the pulmonary arterial hypertension when there is decreased nitric oxide. So how it can be decreased? It can be decreased due to the decreased L-arginine. It can be decreased if there is deficient pathway. If this nitric oxide pathway is deficient, then it can cause pulmonary hypertension. So how can we prevent pulmonary hypertension through this pathway? We can give nitrates and we can give phosphodiesterase inhibitors. So what is the phosphodiesterase inhibitor? These are the sildenafil and like that are available in the market. So the last one, the pathway, is prostacyclin pathway. So what is that? We will go into the detail. That first of all, as you know, that arachidonic acid that is present in the membranes of the endothelium, that is converted to prostacyclin. That is actually the same pathway through which all the inflammatory mediators are produced. So this is also the same. So that prostacyclin also causes the increase in cyclic AMP, that causes the vasodilation and decreased proliferation. So this pathway also helps the prevention of the pulmonary hypertension. So anything that is decreased in this pathway can lead to pulmonary hypertension. So in order to prevent pulmonary hypertension, we also give prostacyclin analogs. So we will conclude this video by getting the conclusion points. What is the conclusion? We conclude by 3 points. Number 1, there should be decreased endothelin pathway. Number 2, there is increased nitric oxide pathway. Number 3, there is also increase of the prostacyclin pathway. So all these things prevent the pulmonary hypertension. Thank you very much.